Hi, everybody. This is Sue Ann from the State Unit on Aging. Welcome to another in our continuing series of 2017 ADRC webinars. This one is, we're real excited to present Introduction to Information and Referrals for Professionals. Just a couple of housekeeping things before we get started. We're going to keep everybody muted because we're recording and we want to make sure we don't have feedback and static background noises. So text chat if you have any questions or comments, and I will be watching for those while Lacey is presenting. If you're attending with a group site, please text chat or email me a list of everybody that's attending from your site, because this class is a prerequisite for the all-day information and referral training. We want to make sure we get everybody credited who's here today watching this. We did send the materials out this morning. If for some reason you registered after we sent them or you were a late registration, send an email to Lori, Lori.c.watt, W-A-T-T, at state.or.us. And in the subject line, just say, I need webinar materials, and she will get them off to you right away. And then there will be an email shortly after the webinar that will have a SurveyMonkey link in it for you to do. This one will also come from Lori, and it's just a very quick, just a couple minutes evaluation of the session so that we can make them better in the future. I'm really excited to have Lacey Hansen with us, and she is one of our State Unit on Aging teammates, and she's our INR expert, and I'm going to turn it over to her. Take it away, Lacey.
Thanks, Sue Ann. Welcome, everyone. So, as Sue Ann said, my name is Lacey Hansen, and I do both the training and support for INR and resource management and reports for the ADRC, and I also provide technical assistance for the ADRC website. So you may have all seen emails from me in the past. So this is the prerequisite for the all-day training, and this is to provide background on the ADRC and how we all got here, and then sort of an introduction to INR. So I'm going to go ahead and get started and look at the agenda for today. So we're going to look at sort of a top-down view, starting with the Older Americans Act, which is really what provided the impetus for what ended up being the ADRC. And then look at 04AD and the SILs, and we'll talk about all these acronyms. ADRC and No Wrong Door, AIRS, information and referral itself, our local standards, how to get certified, and then we'll introduce anatomy of an INR call. Well, the Older Americans Act of 1965 was designed to support people who are aging in the United States to be able to stay as independent as possible and age in place or in their community, basically aging where they choose rather than institutionalizing so many of the older Americans as they were. It also created and supports community-based services such as Meals on Wheels and nutrition programs, in-home services, transportation, legal services, elder abuse prevention, and caregiver support. This also helped many of our seniors avoid hospitalization and nursing home care, and as a result saved on some federal and state funding that otherwise would have been spent on those institutions. The Older Americans Act funds and supports 56 state agencies and 200 tribal organizations and 2 Native Hawaiian organizations. So there's more than 600 area agencies on aging and 20,000 local service providers. So it's really a large network of programs and services. In 2016, we were reauthorized for the 2017 to 19 biennium, so that's what we're working under now. And it also included provisions for evidence-based programs such as falls prevention, and chronic disease self-management. So the Oregon Association of Area Agencies on Aging and Disability is a mouthful. It's usually referenced as O4AD. And this was the system of organization after the Older Americans Act that helped provide the services and programs throughout the state of Oregon. It's one of the leading voices advocating for seniors and persons with disabilities. There are area agencies on aging throughout the whole state. And again, the goal is to protect independence, dignity, choice, and safety for seniors and people with disabilities. Moving a little bit down, getting more specific, this was our map of the area agencies on aging. And I show you this because this was part of what was used to design the ADRC system. So there were these existing area agencies on aging throughout the state. And you can see there are 3 different types. There's a type A, type B, and this is actually a type B transfer type. So we've got most of our type A's in this area, and then our type B's down here, and type B transfers. And part of this has to do with how Medicaid and aging and people with disabilities services are administered, whether through the Area Agency on Aging or in partnership with those organizations. In addition to the area agencies on aging, partners of the ADRC include the Centers for Independent Living. And these were started through a different movement, through the Civil Rights Movement, but kind of came up alongside the Older Americans Act program and eventually came together as having similar goals. It was created by the Federal Rehabilitation Act and a movement on the part of people with disabilities to take responsibility for their own life and make choices on issues affecting every aspect. So again, sort of what we now call the person-centered approach, but giving people a chance to have a voice in their own care. Oregon Centers for Independent Living are community-based, consumer-directed, and not-for-profit. They're not residential organizations, but they serve individuals of any age with disabilities throughout Oregon. These are called CILs, and I'll show you the map in a second. We have lots of different abbreviations for CILs. The core services of a CIL are information and referral, which we're going over today. Peer support, so staff and trained volunteers provide support, encouragement, and guidance. Independent living skills training, assessment and training in areas such as money management, housekeeping, communication, things that support independence. And then individual and systems advocacy. So individuals with disability are taught to advocate for themselves, and CILs can engage in activities designed to affect positive change in local, state, and federal systems. Here's the map of the CILs. So this is called EOCIL for the Eastern Oregon Center for Independent Living. We have Spokes Unlimited, which covers Klamath and Lake counties. Ability, which covers Jefferson, Deschutes, and Crook counties, or Central Oregon. We have the Independent Living Resource Center, which is up in the Portland area. LILA, which is Lane Independent Living Alliance. UVDN for Umpqua Valley Disabilities Network. And HASL, which is a Handicap Awareness and Support League. And I'm just realizing now that I'm not sure what's going on in the white counties. Sue Ann, do you know?
Yes, the white counties do not have coverage at this point, although some of the other ones like UVDN and HASL have offered to cover some of those areas, and Lila has a part-time contract with the folks in the Salem area. So some of them help do that.
Thank you. I should have prepared better. Okay, so using the area agencies on aging and the SILs and the support of the Older Americans Act, the Aging and Disability Resource Centers program and the No Wrong Door system was created. In Oregon, we call it the Aging and Disability Resource Connection, but nationwide, there are others that are called centers. So the No Wrong Door System initiative is a collaborative effort with these three organizations: the Administration for Community Living, Centers for Medicare and Medicaid Services, or CMS, and the Veterans Health Administration. The No Wrong Door System builds upon Aging and Disability Resource Center program and CMS Balancing Incentive Program. No Wrong Door requirements, which support state efforts to streamline access to long-term services and supports, which is another term that you'll hear a lot in this business, is long-term services and supports. And those are just options for older adults and individuals with disability, again, in the spirit of independence and personal choice. So the ADRC of Oregon was first initiated or being discussed in 2007 and 2008 when the Senior and People with Disabilities Office, which is now mostly called the Adults and People with Disabilities Office, and the O4AG, the conglomeration of area agencies on aging, initiated planning and developed a draft concept. In 2008, there was a 3-year federal grant to develop a prototype ADRC, which was in Lane County. In 2009, there was another 3-year federal grant to expand to 9 additional counties. In spring of 2010, the first ADRC opened at the AAA office serving Lane County. And in fall 2010, we launched the ADRC website and developed a 5-year strategic plan. In 2011, we opened ADRCs in Lynn, Benton, and Lincoln County, which is now called ADRC of Cascades West, and then another in Marion, Polk, Yamhill, Clatsop, and Tillamook counties, which is called the Northwest ADRC, and that's at Northwest Senior and Disability Services.
Those are actually our colloquial names, Lacey. Basically, we just say ADRC serving whatever counties.
Yes, and we'll go over that again in a minute.
Okay, thanks.
In spring of 2011, we adopted a 5-year strategic plan to take the ADRC statewide, and we started a consumer satisfaction survey, which we still do every couple of years. And then in 2015, we launched 9 regional ADRCs statewide. And then here we are at 2016 when we renewed our grant for 2017 and 19. So here's a map of the ADRC structure in Oregon. So we have all of Eastern Oregon under one ADRC. However, there are 3 AAAs operating in that region. And then we have Central Oregon, again, a large swath of the state, also comprised of 3 local AAAs. We have the Metro ADRC, which is comprised of Columbia, Washington, Clackamas, and Multnomah. Then we have Northwest, again, which is Polk, Marion, Yamhill, Tillamook, and Clatsop. Cascades West, again, yes, these are the names that we use for the ADRCs. These are also operated as AAAs in the same location. Lynn, Benton, and Lincoln counties. Lane County is its own ADRC, as is Douglas. Then we have the ADRC serving South Coast, which is Coos and Curry counties. And then the ADRC of Rogue Valley, serving Josephine and Jackson counties. Marked in green here are the federally recognized tribes of Oregon as well, which are also supported by the ADRC. So getting into detail about the ADRC, this is the fact sheet and it is included in your materials for today. It's a longer form than this, but I captured the highlights here. So the ADRC of Oregon is a collaborative public-private partnership that streamlines consumer access to a complicated aging and disability service delivery system. We're going to go ahead and acknowledge that all those things that I already talked about, those different services and organizations, are difficult to follow sometimes. So this is helping to create a no wrong door system, or a system where a person can call any of those offices and the ADRC to receive information and be connected to local resources. ADRC information and assistance and options counseling services are free for people of all ages, incomes, and disabilities. The ADRC raises visibility about a full range of options and provides objective and trusted information and assistance, empowers people to make informed choices, and helps people easily access services and support. Then there's some little facts here about that consumer survey, consumer satisfaction survey. But after the people contacted ADRC, people were able to feel like they had support, felt more independent, were able to live in the place they most desired, felt safer in their homes, expanded or maintained their level of activity, preserved their financial resources, and found services they could afford. Services provided by the ADRC system of Oregon include information and referral, information and assistance, information referral and assistance. As we'll talk about in the all-day training, these all mean the same thing. People use them interchangeably. I tend to go back and forth between INR and INA. Also in our database, we use different qualifiers to determine whether a call is information, referral, or assistance. And they're basically increasing levels of support and involvement. But as far as acronyms go, if you hear any of these things, they mean the same thing. We have a statewide website with searchable resources and a client contact module where we can enter those calls, options counseling module to capture decision-making and action plan documentation, and a module for running reports. We also have a statewide toll-free number. If you call that number, you'll be asked to enter your zip code, and then you'll be connected with the ADRC closest to where you're calling from. Another service is options counseling. And that's if there was a continuum here that started from just an information exchange, then referral where you're referring to a number of resources, assistance where you're helping a little more, maybe help someone determine what their needs are, or providing advocacy. And then options counseling would be next in line, which involves trained staff who provide support to make decisions about long-term care needs, short-term service coordination. It's not long-term case management. It's a short-term solution. And referrals to private and public services provided by phone or in person, including home visits. So it's short-term case management towards a specific goal. We also provide access to publicly funded long-term care programs. We also provide eligibility screening for those programs. Prevention and early intervention, so that includes wellness programs, managing chronic conditions, falls prevention, and those other evidence-based services. And then transition support to provide a link between healthcare providers and the ADRC. For example, the Care Transitions Program, which helps people who are leaving the hospital after a long stay to transition back to their home or wherever they will be living. In order to support our information and referral program, the ADRC, when it started, decided to ascribe to the standards and best practices set up by the Alliance of Information and Referral Systems. This is a program for all of North America, including Canada. It's a professional membership organization for community information and referral providers. Goes by AIRS. Diverse membership consists of individuals, agencies, community organizations, governmental departments, and other people helping connect other people to services that they require. There are 5,000 plus members, and we answered collectively about 28 million calls for help last year. So AIRS provides membership, networking, training, individual certification, and agency accreditation. And they also have national conferences and some local conferences. So we had our Northwest AIRS conference last year in Eugene. And that's every 2 years there's a Northwest AIRS conference, either in Washington, Oregon, or Idaho. And the National AIRS Conference also travels around to different locations. This year it's in Tampa Bay, Florida. So AIRS, our governing organization, and I should say the ADRC of Oregon has not gone through the accreditation process through AIRS, and not all services that use AIRS tools and certifications are accredited. That's just a choice that we've made based on cost analysis and also the decisions that we've made as an ADRC to use some of AIRS guidance and not other. So INR, information and referral, as defined by AIRS, are programs that help individuals, families, and communities identify and understand and effectively use the programs that are part of the human service delivery system. They facilitate long-range planning by tracking requests for service and identifying gaps and duplications in services. They also work with human service organizations to make them better. They help people understand their problems and make informed decisions about possible solutions. They may advocate on behalf of those who need special support and reinforce the individual's capacity for self-reliance and self-determination through education, affirmation, collaborative planning, and problem solving. INR services are a vital link bringing people and services together. And that word link is one that's especially important to information and referral. We don't provide the direct services necessarily that people are looking for, but we're sort of the handshake between the consumer and the service. We provide a service both in that way, both to the consumer and to the service provider. For the consumer, we help narrow down resources that they are eligible for and that make sense for their circumstances and choices that they want to make. And for service providers, we provide referrals of consumers who are eligible, know what they're looking for, know that this service is something they're interested in, and already educated on some of the parameters of the programs. INR staff have a Bill of Rights according to AIRS. And that includes the INR service maintains accurate, comprehensive, unbiased information about the health and human services available in their community. They provide confidential and/or anonymous access to information. In the case of the ADRC, we're not anonymous unless that's somebody's choice, but we do ask for contact information, but we are confidential. All of our staff are trained in privacy and HIPAA rules, and our database is protected, and we have rules regarding sharing of information. INR service provides assessment and assistance based on the inquirer's needs, provides barrier-free access to information. That means we don't ask for anything. Recognizes the inquirer's right to self-determination. So we give the options. We don't tell them which to choose. They provide an appropriate level of support in obtaining services, assure that inquirers are empowered to the extent possible, and assure that inquirers have the opportunity to access the most appropriate service available in the system. The ADRC of Oregon has a set of standards that we use for our INR services statewide. Right now, these are not enforced by anything other than the fact that they exist. They're guidelines and best practices, but they are meant to be followed as closely as possible. Our standards include the ADRC staff provide INR services according to the guidelines listed in our policy and procedure manual, which is available on the help page. ADRC staff are knowledgeable about ADRC resources and services and explain how to get help or information. ADRC staff spend enough time with consumers to understand their concerns and ensure the consumer feels respected and receives information in a person-centered manner. We record the data in our state information system, including information about the caller, consumer, demographic information, met and unmet needs, and referrals. And we'll talk more about why that data is so important, but it is one of our most important standards here. Follow-up calls are performed according to the INR follow-up policy, which is also listed in the help section of the website. Follow-ups in general are made if you feel that a client or consumer could use a check-in in a couple of days or a couple of weeks based on your telephone call, or a follow-up includes a referral to options counseling, and when the options counselor calls back. We ask that all INR staff obtain their ADRC certification within 18 months of hire, that we identify potential options counseling consumers, that we promote health and safety of our consumers, that we provide services according to ADRC standards, and this one is also important and will be discussed more during our training, that we only refer to services maintained in our database. ADRC certification. So ADRC standards say that INR staff should attempt certification within 1 year of hire if possible, except I just read that it's 18 months, so I'll be changing that. So some of our staff will not be eligible based on ADRC requirements. These are the requirements to become certified, and it's a combination of experience and education. So someone who does not have a high school diploma or any higher degree must work in INR for 5 years before being eligible to take the test for certification. 3 years with a high school diploma or GED, 2 years with an associate's or community college degree, and at least 1 year of employment in INR for applicants with a bachelor or higher degree. So that can be discussed with your supervisor or with myself, and you may have performed INR in another organization before coming to the ADRC, and that does count towards your certification. Certification for INR specialists in aging and disabilities is the SEERS certification. Well, that's what it stands for right there. Aging and disabilities, so the AG. It's designed for practitioners who work directly with clients and caregivers within aging and disabilities. It also is an add-on, so if you have a CIRS certification, I think you can still take a shorter exam to get the add-on of aging and disabilities. So the exam is a computerized test that can be taken in a classroom environment or can be set up as an online proctored exam. It consists of roughly 100 questions. It's multiple choice. It's also pretty passable. Again, especially if you have been doing INR for at least 1 year, I would say it's a common sense type exam. And then once you become certified, you don't have to take the exam again. You just have to recertify every 2 years, which just involves documentation that you've attended some kind of training that supports your work. And most of us have a couple of trainings here and there throughout the year, and you just have to do 10 hours over 2 years. I don't have the AIRS website on here, but it's just airs.org. And there's information on there about how to set up an exam. We usually try and do at least one exam every year, usually somewhere in the metro region. Additional tools available for INR staff are our own ADRC of Oregon website. Also, NASUAD, which is the National Association of States United for Aging and Disabilities. They have some free training webinars or videos on their site. If you're just getting started, those can be helpful to watch. And then a site that used to be called the Technical Assistance Exchange has now changed to the No Wrong Door website provided by the Administration for Community Living. And I looked on it the other day and it looks like they're still rebuilding that. The Technical Assistance Exchange used to have documents that different INR services throughout the country would upload, policies and training manuals and things like that, that then were able to be used by anyone. And I took advantage of some of those things before just to get ideas about how to train on certain topics. There were also some statistics on how many INR services there are and things like that. So I'm hoping that more of that content gets included, but it's a good place to go to just educate yourself on the greater INR system across the country. And then the Oregon State Unit on Aging website has a lot of good information, including a training calendar for options counseling and INR trainings. There is a monthly technical assistance training that's on the second Tuesday of every month. It's an hour for INR and an hour for the CARE tool that just goes over data entry for both of those. And then every other month, there's a training on the reports module if you're interested in learning how to run reports and organize reports from the system. And that is all I have for today. We went through sort of an overview of how we got here, and then what INR is as a profession. And when you come to the training, the all-day training, we're going to really dive into what a call looks like and how to get through a call and use the tools and use the system.
And we want to remind you guys that there are still seats in a lot of the trainings. So if you haven't gotten the email with all the links in it yet, please let us know and we will make sure we get that to you. We have quite a bit of room. We have a few seats left in White City for April 21st, which is down by Medford in Southern Oregon. So those of you maybe from the South Coast might want to see if you can get into those. And then Clackamas in early May, so Oregon City, La Grande in June, and Bend later in June, And then we'll be adding probably one more Metro Portland area because those 2 classes kind of filled up fairly quickly. So please let us know if you need the links to register. I was actually taking notes of who's here today because this is a prerequisite for coming to the all-day training session. So we do want to make sure that that happens. And several of you had a group site, so I thank you for letting me know who all was there. We can open it up if anybody has any kind of questions for Lacey. We're not going to open the phone lines again because we're recording. We don't want the background noise, but you could chat questions in for us or put them into the question piece, either way. So we'll give a few minutes in case anybody has any questions. We look forward to seeing some of you tomorrow and some of you next week and some of you later in May and June. Thanks, Lacey, for giving us this overview. This was great. And you guys watch, please, for an email from Lori with just a quick little survey monkey that will tell us what you thought of today and how we can make it better. As our usual, we do this every month. Next month is May 10th, and the topic, we'll be talking about APS and how we work with APS in our ADRCs. So I'm excited to offer that one also. So anything else, Lacey, that you thought of, or I'm not seeing any questions.
No, we do have one question from Angie. Do we need to bring anything with us to the training? And no, each of our trainings will be in a room with computers. We're going to have you log in there. If you can make sure that you have your login and password before you come to the training, you can test it out the day before. That will help so that we don't get bogged down trying to reset passwords. But if needed, we can do that there. But otherwise, we'll have all the materials. Maybe bring a pen, but otherwise we'll have folders with lots of handouts, and we'll have all that there. Another question was, do you recommend the full day training for options counselors? You know, it wouldn't hurt. Right. It really helps inform that process, and also because options counselors are going to be part of that job is helping to get people connected with resources. It really is so similar to options counseling. Mm-hmm. So while some of the technical pieces of entering things won't be the same for options counseling, there are pieces like the demographics and things like that are the same. So I'd say, sure, if there's space, we're happy to have you.
Yeah, I thank you, Lacey. I totally agree. I don't think it can hurt options counselors, and many of the options counselors statewide also do some INR. So it would be great to, have that, like you said, have that whole process of what it's like from start to finish. So great question, all of you. Thank you. So again, don't forget to sign up. We're going to have Lori send you guys the survey. And if there are no other questions, and Lacey, you don't have anything else, we're going to let you guys out early.
Thanks, everybody.
Thank you.